Before getting the patient, I bring them up on the computer and set the room up. Since we are starting with chest, I use a 14 by 17 grid and set the tube at 72 SID. And don't forget radiation protection, always shield your patients. After the room is all set up, I go out, get the patient, introduce myself, and verify information and the doctor's orders. Once the patient is in the room, I will ask about history. I will ask questions such as, where's the pain, which side, and is there a specific location that hurts the most? I will also ask how long they've had the pain for, and if there's any chance of pregnancy. If there is no chance of pregnancy, I will give them a gown, have them change from the waist up, and remove their bra, anything metal, and any other artifacts that might show up on the X-ray. In this case, our patient was having right upper anterior rib pain, so we put a nipple marker in the area that hurt the most. To start off, we will do a PA chest X-ray. This is to make sure that no ribs are puncturing the lungs, causing hemo or pneumothorax. If you suspect any of this, you would immediately stop the exam and notify the radiologist. If everything looks normal, you can continue the exam. For both the oblique and PA projection, you should use a 14 by 17 grid and a 72-inch SID. Since our patient was having anterior rib pain, you put the affected side closest to the IR. So in this case, we did the X-ray PA. You would center at T7 with the top of the IR 1.5 inches above the shoulders. Center the patient as you would for a chest and keep the collimation fully open. Suspend respiration on inspiration. Next, we did the oblique. Since the patient is in PA, the affected side is away from the board. Always remember, PA away. Suspend respiration on inspiration. After all the above diaphragm images are completed, we then have the patient lay supine on the table for the PA and oblique lower ribs. Also used is a 14 by 17 grid and an SID of 40. Once the patient is on the table, you will then center for AP below diaphragm ribs. Central ray should be centered to the level of the xiphoid process. Lastly, for the below diaphragm oblique, we oblique the patient 45 degrees toward the affected side, centered midway between xiphoid and lower rib cage, and collimated side to side.